Motion would be to authorize the city attorney to bring or participate in any necessary action with other jurisdictions challenging A.R.S. Section 13-4296 in whole or in part. And 2, to take any necessary or desirable legal action regarding any complaints or claims filed by any claimants under A.R.S. Section 13-4296 up to and including litigation.
So moved, Your Honor.
Seconded.
There's a motion and a second. Any further discussion on this item? Hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. Any against? Motion carries. What is the council's pleasure for item 4?
Your Honor, appropriate motion would be to move that the mayor and council authorize and direct the city attorney to proceed as discussed in executive session to include the settlement of this tort lawsuit in the amount of $150,000.
What is the council's pleasure?
So moved.
There's a motion.
Second the motion.
There's a motion and a second. Any further discussion on this item? Hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. Any against? Motion carries. Item 6.
Your Honor, an appropriate motion would be to proceed as discussed in executive session to proceed with the selection of the next city clerk.
May I get a motion?
So moved.
Second.
There's a motion and a second. Any further discussion on this item? Hearing none. All those in favor, please signify by saying aye.
Aye.
Aye. Any against? Motion carries. All righty. Item 7. Item 7, time has been set aside for mayor and council to receive an update on strategic initiatives related to the fentanyl opioid public health crisis. This is an item that we have been hearing for the last, I would say, 2 years in the city of Tucson. This is something that mayor and council and the Pima County Board of Supervisors have been working on most recently. I want to make sure that Mr. Manager, we have a presentation and then we can go on to questions and comments from my colleagues.
Thank you. Honorable Mayor, members of the council, joining us at the table is Lee Hopkins. She is our Community Safety, Health, and Wellness Resource Manager, and she'll be guiding the discussion from the staff standpoint with an update on these matters. So take it away, Lee.
Thank you so much. Thank you, Mr. Manager and Honorable Mayor and members of the council. So nice to be here with you today. Can you still hear me this way? No, I'll get a little closer.
You can pull the mic your
perfect.
way as well.
Thank you. That's all. I should have done that. Perfect. No, thank you. I have had 3 coffees, so. So just to start out, I will review the update that I was planning, but just as we were sitting here, I received a text from one of our care coordinators, and I would love to just really briefly share what that was about. So our care coordinator, Daniel Reyes, who is also an NEMT, sent me a picture of himself with an individual lying on the ground outside of the El Pueblo neighborhood complex where our office is, and he had just administered Narcan and prevented an overdose death. And so I spoke with him and he explained what had happened. Our staff assistant, Christian Kiwis, was heading out of the office complex and had seen this man lying face down. Folks were trying to resuscitate him and he wasn't coming. And so he called Daniel. Daniel grabbed Isaac Villegas-Durgan, one of our community enrichment coordinators, and Askia Mohammed, one of our housing navigators from the Housing First team, and the 3 of them went there. Daniel administered the Narcan. The gentleman came to, and in the meantime, Isaac was calling 911, and Askia was kind of watching out, making sure that everyone was safe and everything was under control. The medics came, they took him to the hospital, and he survived. So that's just an example of what we do day in and day out. So for my planned agenda, I'd like to start with just an update on the structure of the Regional Opioid Settlement Advisory Committee and our plans for the 2026 year. So our meetings are switching to bi-monthly every 2 months. And from those meetings, we will be receiving updates on the finances and the funds that are coming in. We will be overseeing the implementation of the grants that I'm going to talk about shortly that are out in the community and the hard work that'll be being done by those contracted entities, but also providing kind of evaluation oversight, making sure that things are having the impact they're intended to. And then last but not least, we'll be advancing policy priorities that are identified, where as multi-jurisdictions, we can come together and really push the agenda forward on the policy issues that we know are impacting our ability to save lives and prevent addiction. So I will be reporting that back as I receive that information to all of you as well. So it's a really exciting day because we have a lot of positive news and motion in the right direction. So the first thing I'd love to talk about is the Safer Center, which you all are familiar with by now. So that is officially live. They started taking patients January 1st. And just today, our care coordinator, Michelle, and she went out with TPD Core this morning on some deployments and took the first 2 patients to the Safer Center. And she shared that it was a very smooth intake process. And so they are live and ready to go. So just for a brief overview for folks who want a little bit more detail on what that is and who is involved. The $1.8 million contract was won by Community Bridges, who currently is a detox provider, as well as they provide a number of services related to behavioral health care and shelter. They also have a subcontract with Kodak, and the evaluation of their work will be conducted by CIRO at the University of Arizona. So that $1.8 million contract will be for the first 6 months of the pilot. And we will be doing ongoing evaluation throughout that to see what needs to be pivoted as we go. It's 15 beds that are dedicated to this model. It is exclusively funded by the opioid settlement funds. And it's really intended to complement the existing detox and behavioral health services that we have in our community, because we know that we need more of it. So some of the things that are unique about the SAFER model that we have fortunately worked really closely with CBI, and I want to highlight the work of the health department in really leading this conversation and the negotiations, that CBI is going to implement the model compliantly as intended. So people can bring a pet, they can bring personal belongings, they have access to showers, warm meals, laundry facilities, a comfortable cot, and can stay up to 96 hours. And that's one thing that's a really key difference is that length of stay. Typically we see detox around 23 hours. And that's what is reimbursable by insurance. But the 96-hour model allows people to have a few more days to recover, but it also allows for the time to do that discharge planning. And what I mean by discharge planning is for a care coordinator or a navigator to be able to sit with that person and really make a detailed plan and then advocate on that patient's behalf to enact that plan, to go to housing, to go to rehab, to work out the pre-approvals that are needed with insurance, et cetera. We do find that a lot of folks fall through the cracks between like post-detox, trying to get into the next step. And so having those extra few days is really, really critical to be able to do more thorough planning and have folks not kind of fall through the gaps or leave. So the other factor that's unique about the SAFER Center is that most of our detox facilities focus on alcohol and opioids. At the SAFER Center, it can be any form of substance, including meth and other stimulants. And that's really important because we know that a lot of folks are polysubstance users. It's very rare that we find someone only necessarily doing fentanyl. Often it's a mix. So this allows for an easier open door for folks who are using a broader variety of substances. For the initial phase of the SAFER Center, we want to be able to really see this impact on our Safe City initiative efforts and on how we can continue to deepen our deflection away from the criminal justice system towards healing and treatment. And so initially, folks, the people, the entities who can refer folks to the Safer Center will be our Operation ClearPath, TPD and outreach deployments, our TPD core team and the community safety, health and wellness co-responders who go out with them, as well as the transition center. So we are all meeting behind the scenes, working out the details of those referral pathways, and we're really excited that it's moving forward. So next, I want to also share the really exciting news that as of today, the Board of Supervisors has approved the proposed contracts for the remaining $5.4 million of opioid settlement funds for the first year of grant making. The funding that is going out is funding youth prevention services, peer navigation support, transitional wraparound support, law enforcement co-response, and by embedding behavioral health workers with law enforcement agencies throughout the region, not just TPD, but all of our law enforcement agencies. We're really excited about the vendors that were selected and the work that's going to be done. The only area that wasn't funded because no one applied for it is the mobile mat pot of funding. And so ROSAC is actually meeting tomorrow for our bi-monthly meeting. And so there's about 1.4 million left that was not distributed. And so we're going to be talking about how to revisit that request for proposal and really make sure that we can engage the vendors to have more applicants for that, because mobile med, both in the city of Tucson as well as in rural areas, is in a gap that needs to be filled. So I have the details of the vendors and would be happy to answer any questions, but I won't go into that detail unless you would like it. And last but not least, I want to highlight some of the complementary work that we are doing here at the city. So we continue to do co-response with TPD, but we also continue to provide care coordination and engagement with anyone who is struggling with substance use dependence, behavioral health needs, and other social service needs to get them connected with the right resources. So our Housing First and our community safety care coordinators and our community enrichment coordinators are all doing that work day in and day out. And so in the past, since April of this year, from April to December, I'm really proud to share that we navigated over 100 individuals into treatment. And I think that's an undercount, but at least 100 individuals according to our records, and 2,000 community members and first responders were educated about how to identify an overdose and how to prevent it. So we've been doing a lot of really targeted education and support for folks. And last but not least, I'd love to just share a quick story about our work. This is someone who our care coordinators work with, and she gave permission for me to share her real name. Her name is Jessica. And so we met Jessica at a park in the city, and she did express interest in going to detox. She had just lost her son. She was struggling with addiction. We got her into detox. There were too many delays in getting her into rehab once her 23 hours were over, so she went back to the streets. We stayed in touch with her, got her into shelter. She left the shelter. A few weeks later, got her back into another detox. And this is because we continue to provide that peer support and build that relationship and have that trust. So even though she was hitting all these gaps, she kept coming back. And so the last time that she went to detox was successful. She was transferred then to treatment. She was successful in treatment. Then we were able to advocate for her to get into Emerge, where she is receiving housing support and employment case management. She now has a job as a caretaker, and she's in the process of getting custody of her son back. So that is an individual who was supported by our care coordinator, Michelle Keller.
Thank you so much for sharing both this really wonderful story and the first more concerning, right? That the work that you all do in our Housing First program and our community safety, health, and wellness program, in our multidisciplinary outreach team, the work that you do in partnership with our police officers. Is sometimes traumatic and devastating, but the last story really, really explains why we do this work. And being able to see the people that we're serving as human beings that have family and have, dreams and aspirations and have a disorder, and substance use disorders is important for me to be able to continue this work. And the incredible amount of work and dedication from our staff is something that I am profoundly appreciative of. You're all on the ground. You all see this firsthand. And, even though mayor and council created these programs and innovated, you're all making it happen. And the amount of need out there is incredible. And that's why using the opioid settlement funds strategically and in a focused approach is so important for me. So thank you so much for the update. Thanks to all of those that do this work day in, day out, from our police officers at TPD, our outreach teams, our care coordinators, our Housing First navigators, each and every person that's involved. I really appreciate the incredible work that you do. That's why I think that these updates are important for all of us and for the community to be able to pay attention to, so that they do know exactly what we do day in, day out. I'm really happy about the opioid settlement funds finally going out into the hands that need this investment. The Safer Center is something that we, the mayor and council, have been talking about for the last, 2-3 years. That we've been saying how important that the opioid settlement funds fund this work. I am looking forward to see how it is all patched together to make it work. I'm really happy about the University of Arizona Southwest Institute for Research on Women, CIRO, getting involved in terms of looking at the metrics. What are the results of this investment into SAFER? I really want to make sure that I put also a thank you to our colleagues on the Pima County Board of Supervisors, and then the members of the ROSAC committee that spent hours and hours and hours in helping make decisions on how we invest these funds. I want to be very clear about the work that we're doing with SAFER in terms of trying to deflect jailing people and putting them through a process of medically assisted treatment and detox, and then connecting them to the other services to be able to deflect that putting people in jail. A lot of people make it sound very easy. We'll just put them in jail. And without really understanding that putting people in jail actually costs a lot of money, and that these investments that we're doing instead, especially with the opioid settlement funds, make so much more sense than just throwing away money that is not really helping anyone. So the goal is to put people through treatment and put them through, give them the help and the resources that they need. I just wanted to talk about the metrics for the investments, especially in the educational pieces, and then directing the funds. I'm thinking about the peer navigation support and the transitional wraparound support and the funds that are being invested in that. I really would like to make sure that we also have a strategic and focused approach, even in the educational pieces, because we've seen through evidence that just investing, even if it's educational investment, just throughout, like just scattering it throughout, doesn't make as much impact as when you focus in the areas of need. So for me, even on the educational pieces, I would like to see a focused investment in areas and neighborhood schools where we have the data that proves that we have the most calls for service and that we have the most calls for um, overdose calls coming in. Viva sites, thrive zones. These are the areas where we know there's the greatest need. And those are the areas where we should be investing even the educational funds in. Because we know that the youth in these areas are the most vulnerable to falling into opioid use in our community. And the same thing with the peer navigation support and transitional wraparound support. I guess my question is, let's make sure that these investments are being done to supplement the work that the city of Tucson, Housing First, Community Safety, Health and Wellness, TPD, our core teams, our safe city deployments, that we're really working with Pima County Justice Services to supplement the work that we are doing and where the greatest needs are. I guess that's my observations and my request that we do that. But again, congratulations to Rozak. I'm really enjoying the work that I'm doing and my colleagues are doing with the Pima County Board of Supervisors. I think the more conversations we have about the need and how to strategically invest the opioid settlement money, the better results and the best investments that we're going to see happen. So thank you for sitting at the Rozak and for the update today. Vice Mayor.
All right, thank you, Mayor and Lee, for the updates and also for sharing those stories. I think it helps ground why we're doing the work that we're doing. You mentioned the 1.42 million that didn't get awarded for the mobile medications. Have we heard anything from the agencies about why the request didn't line up with the services they could provide?
I hope to hear more about that tomorrow during the meeting. We haven't previously, because we weren't able to know the details of the procurement process because it was confidential. So tomorrow in the meeting, that's definitely something that we'll be digging into, is why didn't more folks apply? What are the barriers they're seeing? How can we make this more appealing for folks to apply to and implement? Because we know that there's a lot of great providers who could be doing this work. So that is on the agenda for tomorrow. And
Yeah,
I can
because I'm
report
curious
back.
too why agencies like SAFE, who've been doing some of that work more recently, wouldn't be one of the agencies that we tap in to help us out. The next thing was for the Safer Center and how people can get diverted to receive services. Is it currently only when they have like a police interaction that they can get referred to? Or are there other ways, like if somebody's already in a shelter or receiving other services, can they also refer somebody to the Safer Center?
So for the initial phase, we have determined that they can be referred from the transition center, which is exiting the jail. Folks can also just walk into the transition center. They don't necessarily have to come through the jail, but that would be one of the main places. And then, yes, the other two options are when CORE is doing their deployments and with our special Safe City initiative, Clear Path deployment. So the initial plan was for those referral pathways to primarily be from those channels for us to really be able to then measure how Safer is impacting our deflection efforts, whether it's making a difference.
All right. Well, thank you, Lee, for all your work and your team. Appreciate you.
Thank you. Councilmember Cunningham and then Councilwoman Lee.
Just a few things for your team. Lee, I just wanted to congratulate your team over this past week. We've collaborated directly with them on 3 different cases in our office, and we had really positive outcomes this week. And it's kind of neat that it's starting to ramp up, where we're seeing this collaboration kind of come together, where pieces are, but where we're finding the gaps. And there are some gaps out there that I want to bring to people's attention. One of the gaps we have is very temporary placement. So what happens is a lot of times we have people engaged and we don't have room for them that instant, but we have them engaged and then we lose them, just like we just talked about with one of the cases you just said. So having 1 day or 2 day respite available with some immediacy is one of those pieces that we need. Another one I can tell you is family movement. Okay, so if you have a family or a household that's being moved, having them move to one shelter to a placement to, or from placement to shelter to a possible permanent is really hard on that family. And if they're moving 3 or 4 times in 1 month or 1 week, one of the ways we can help is by helping facilitate that and having some opportunity to do that. And we were able to help this week. One of the pieces that we're having is transportation outside of state. So we have different families who are here temporarily and they're trying to get somewhere else. We really don't have the best avenue to act quickly and have their move facilitated. And so we're going to work on one. We're working on one of those cases like right now out of our office. So I wanted to bring those things up because these were all cases that came up this week that we ran into. Specifically, we had a person who is actually not having some substance abuse issues, but definitely needed some immediate placement to bridge the gap before they got a more permanent situation. And so we were able to help with that. So there's some opportunities to do those things. And if you're curious, if anyone on the council offices are curious on how we're doing that, how we're going about it, or we'll definitely be able to help. But those are some of the things that came up this week with each different case. And each different case is different. It's challenging. The family dynamics are challenging. There is zero one size fits all when it comes to this work. And so I just wanted to make people aware of that. But again, happy to collaborate and kudos to Kim and you. You know, when we talked this morning, I'm just so excited about the work you guys did in this last month, especially specifically, you know, the case I'm talking about. All right, thank you.
Councilwoman Lee.
Thank you, Mayor. Also want to double down on what the mayor said about metrics. I think that's going to be really, really important to know, what our baseline is, what our targets are, how are we measuring success with these dollars? Because as you've said, Mayor, these are one-time historic investment that can be made, and we have to be very precise and targeted in how we're using this because the money and the time is going to fly by. So I'm definitely with you. I'd be curious to know, now that the board has voted on the other funding mechanism or the other programs, how are we going to measure success with that? The other piece I'm curious about, and Lee, you may not know the answer to this. I don't know who might, but it sounds like 23 hours is wildly insufficient for insurance or access or whomever is paying for that service. And we're at 96 hours. And so I'm really curious how, is there anything in the works with access or anywhere else to change the criteria so that people can get the level of help that they need? Because I know that will also be a financial piece for us too, right? Because we could bill for that up to 96 hours. So do you know of anything that's in the work or how we could try to solve that?
So I am not an expert in that area, so I don't want to misspeak. I am meeting very soon with the state representatives that manage the opioid settlement funds for the state. And so I will be talking about that conversation kind of at a policy level. How are we moving that forward? But as a side note, I know that in California, this model has expanded, and Medi-Cal, which is California's Medicaid system, now does reimburse sobering centers. So other states have started doing it, and so we can be on that path.
Okay, I'm just saying the legislative session is starting, and if that's something the mayor's saying preach over here, if we can get Laura connected to advocate for that, I think it could be huge for our city and cities across the state. I'd love to solve that.
Absolutely, Councilman Lee. Any other questions, comments? Council Member Schubert?
Thank you so much for being here. And I'm just so excited and hopeful about this work that's being done, echoing the appreciation for metrics and measurement and looking for success. And I just want to add on top of that, telling the story to the community. We get calls all the time at the Ward 6 office. We get emails about how people are experiencing this crisis in their own neighborhoods, whether it's loved ones or random people that they don't know but feel concerned about and want to know what the efforts are. So we definitely want to be there to tell the story. I had a similar question to Vice Mayor Santa Cruz about the mobile. Not getting any applications was surprising to me. So we're definitely interested in the Ward 6 office to hear about whatever you learn from that, like what barriers there might be. And if there's anything that we can do to spread the word or like recruit some good service providers for that, because I think that is a really promising intervention, being able to meet people where they're at and stuff like that. And I know that we want to do a tour of the Safer Center. So yeah, definitely. So thank you so much. Really appreciate it.
All righty, if there's no other questions, thank you so much for bringing us good news. Thank you for sharing the important stories of people and the work that your teams do. And you're the ones that are on the ground, from our core officers, TPD, all of you Housing First care coordinators, Housing First navigators. I think it's important that like stories that you've told today and us connecting what policies do we need to advocate for change in are very, very important. I think that's why these presentations and updates are important. So I think we're gonna put on the list of our state legislative priorities that we advocate for additional funds for longer stays at our Safer Center. So thank you so much. Really appreciate it, and looking forward to continuing to hear on this incredible work that you all do.
Thank you, Madam Mayor and members of the council. Thank you for your support.
All righty, we move on to item 8, or is it item 8? Yes, there has been set aside some time to give the mayor and council an opportunity for discussion and direction to matters that are pending in front of the Board of Supervisors and other regional jurisdictions. I'm just happy to announce today that, of course, the recommendations of ROSAC Committee were moved and forwarded by the Board of Supervisors. This is incredible work in partnership with the City of Tucson, the Town of Marana, and the City of South Tucson. We all decided to bundle in our opioid settlement money together so that we can make the most significant impact. As you all heard, these funds, the first tranche of funds, were put out. For us, I think the funding for the Safer Center, the Sobering Alternative to Recovery Center, this is a conversation that Mayor and Council have been having for 2 to 3 years at the least. And it is an important transformational pilot program that we will learn a lot from and be able to adjust and move. But these opioid settlement funds are so important to be able to try these innovative approaches and transformational work that will make a real big impact in the city of Tucson. I'm just keep hearing Dr. Teresa Cullen from the Pima County Public Health Department saying how important and transformational this work can be. And so let's just make sure that we keep that feeling and that approach to working with the Pima County Board of Supervisors, the Town of Marana, and the City of South Tucson to keep moving this important work forward. Other than that, I'm going to open it up for the city manager to move forward with.
Thank you, Honorable Mayor, members of the council. We've provided our standard written report on activities in other jurisdictions. Project Manager Vega is here in case you had any questions or follow-up on that. But with that, no further report for today.
So if there's no other questions, comments, observations, we're going to move on to item 9. Time has been set aside for mayor and council to receive an update on state and national legislation and regional committees, executive orders, and direction to any associated litigation. Mr. Manager?
Honorable Mayor, members of the council, for this item, we have provided the federal report from Bracy Tucker Brown and some updates on state level activities. And joining me here at the table is our Director of Intergovernmental Affairs. I hope that's it. Yep, there she is. Laura Dent. I saw her out of the corner of my eye and I'm like, I hope that's Laura. So I turn it over to Laura Dent. Thank you.
Thank you, Mr. Manager. Good afternoon, Honorable Mayor and Council. It's so good to see you today. We are going to start with some state updates and then move into federal and keep it brief. I know you've had a long session today. So we are fast approaching the second session of the 57th legislature. Opening day is Monday, January 12th. So far, about 200 plus bills have dropped, and we should expect another 1,500 or so in the next few weeks. So formalities on Monday include Governor Hobbs' State of the State address in Phoenix. There will be a Tucson address that is currently scheduled for Wednesday, January 21st. The year ahead is going to be a big one at the legislature. I know I don't have to tell you, but it is an election year and the state is facing some fiscal challenges. This is especially true as the state navigates conformity with H.R. 1, also known as the federal One Big Beautiful Bill Act. And how that connects to state budgets. So issues to watch this year include tax conformity, Colorado River water negotiations, Proposition 123, and potential reauthorization of that in relation to education funding and more. So I've been working diligently to engage our delegation on City of Tucson priorities and circulate the state legislative agenda that you all drafted and approved late last year, and work with you and state leaders to shape opportunities for education events around the City of Tucson legislative agenda and how to make sure that we're building bridges between the legislature and this body. So I'm seeking alignment on our legislative agenda and introduced bills, and I'm looking forward to keeping you and staff engaged on progress in the coming weeks and months. I'll also add briefly on a federal update. This week, Congress could vote on a discharge petition to extend Enhanced Affordable Care Act premium subsidies. And lawmakers in the U.S. House could also move a bipartisan fiscal year 2026 minibus, which would cover commerce, justice, science, energy and water, and interior spending bills. And I believe Mayor Romero has more to share about that, which is some good news for the region. So with that, I will conclude my report and hand it back to you, Mayor.
Thank you so much. I really appreciate it. No, I don't.
Oh,
An
okay.
update.
My regrets. I am happy to share that update
Yes,
if you'd
please
prefer,
do.
Mayor. Okay. We just want to acknowledge and thank delegation leaders, including Congressman Siscomani and Senators Kelly and Gallego, for securing a $4.2 million investment in the Commerce, Justice, Science spending bill. We're hoping to see and looking forward to seeing Congress pass that bill to help modernize Tucson's public safety fleet, which is a conversation that has been in progress at the city for some time, and will improve officer safety, strengthen our ability to deliver effective community-based safety services. So
Thank you for covering me on that. I didn't. I did want to just report to my council colleagues that I have been invited to go to the opening ceremonies of the state legislature on Monday. I know that some of you have been invited as well, and so it's a good thing for for the mayor and council to attend the opening ceremonies, to just be visible at the state legislature, and that I do encourage, lobbying days from all of us to go visit not only our delegation, but other leaders in the state ledge, and that Laura has been, having this communication with our delegation from Tucson, and we will continue to advocate for the policy priorities for the city of Tucson. But do encourage you to go up there and and have some one-on-ones with the state legislature.
Thank you, Mayor. And if I could add, so fantastic to have representation at opening day. If your offices and you are planning on doing that work, if you don't mind coordinating, would love to make sure we're maximizing your time, making sure that you're connecting with the elected officials that are high priority for you, staff, et cetera, and working with our lobbying partners. So please do let me know how I can support in that effort as we kick off the session.
Any questions, comments, anything? Alrighty. Thank you, Laura. Really appreciate it. Thank you, Tim. Thank you. Alrighty, so we move on to item 10. Does anyone have any items to remove from the consent agenda? Councilmember Dahl?
Thank you, Mayor. Yeah, for discussion purposes only, I'd like to remove items D, E, F, and G from the consent agenda. They're all having to do with fiber optics.
Good. Any others? Righty, hearing none, we're going to item 11. Does anyone have any items for future agendas? Alrighty, hearing none.
I do, Mayor, sorry.
I just,
For the future.
Councilmember.
Thank you, Mayor. For a future meeting, I would like to add acknowledging the youth artists for our safety calendar for the next meeting.
Yes. For special presentations?
Yes.
Yes, I thank you so much for reminding me. Absolutely, thank you. Any others? Okay, hearing none. Item 12 is adjournment, and I usually like to give us a little bit of time. So what time is it right now? So we can come back at 5:30, and we can start on time. Perfect. Thank you so much. Thank you.